Hello friends, I am Dr. Rohini Ruhil. Today's topic of discussion is cities and health. The first question is, what is a city and why cities came into existence? As we look back into history, the transition from nomadic hunter-gatherer society to a settled agricultural communities was a key catalyst. As societies became more complex, trade between different groups began to flourish. Certain locations, often near rivers, coasts, other transportation routes, these became focal points for trade, and over time, these points evolved into cities. Cities also emerged as centers of power and administration. Later, cities also became centers for cultural and social interaction. The development of technologies and later industrialization further facilitated the growth of cities. The Industrial Revolution, in particular, was a significant driver in the rapid expansion of cities in the 19th and 20th centuries. It would be apt to say that cities prioritize commerce over the health of people. From the beginning, urban planning often prioritized economic development over public health. For instance, the design of many cities with an emphasis on automobile transportation has led to increased air pollution and sedentary lifestyles, adversely affecting respiratory and cardiovascular health. Additionally, the lack of green spaces in many urban areas reduce opportunities for physical activity, relaxation, impacting mental health, physical health. City policies also support industrial development, construction projects, or other economic activities that may lead to environmental degradation, pollution, other health hazards. Pursuit of economic benefit can sometimes lead to a neglect of public health initiatives. In 1977, Michael Lipton came up with the urban bias thesis, which basically says that cities get an unfair share of economic development, leaving rural areas behind. There is this idea that goes against what Lipton said. It is called the misleading urban advantage. It points out that even though city life seems to have a lot of perceived benefits, but this can hide the underlying challenges and inequalities. In fact, for some people living in cities, there is no urban advantage at all. According to WHO report, about 900 million people currently live in slum conditions around the world. With the double burden of health problems, the urban poor suffer the worst of both worlds. Much of the global deaths caused by NCDs are concentrated in cities. Moreover, urban environments offer favorable grounds for the spread of infections. As we have seen during COVID-19, high population densities, slums, international travel, and migration made metropolitans the hub of pandemic transmission. Further, health inequities are highly prevalent in cities. The UNICEF State of the World's Children 2012 report noted millions of children live in close proximity to hospitals but are still deprived of even basic health services. The 2015 Save the Children report said that one of the worst places to be a mother is in an urban slum. An analysis of urban data from 79 low middle income countries revealed that children in the poorest fifth of urban households are more than twice as likely to die before their first birthday as children in the richest fifth. This shows that urban advantage excludes millions of people. Now, there have been several pivotal events and documents that have shaped the discourse and action on urban health. The World Health Organization conceived the Healthy Cities Initiative in 1986. The goal was to put health on the agenda of decision makers in cities around the world, respond to health issues that have emerged due to urbanization. The Second United Nations Conference on Human Settlements, Habitat 2, resulted in the Istanbul Declaration on Human Settlements, which recognized the impact of rapid urbanization on health and called for sustainable urban development practices. Then, Rio Political Declaration on Social Determinants of Health in 2011. This declaration, emerging from the World Conference on Social Determinants of Health, we have studied social determinants of health in a separate video. So there was a conference on this, and that acknowledged the significant role urban environments play in shaping health outcomes. SDGs, especially Goal 11, aim to make cities inclusive, safe, resilient, and sustainable. This 11th SDG goal directly addresses urban health issues by focusing on reducing pollution, providing access to safe and affordable housing, and improving public transport, among other targets. And this new Urban Agenda 2016, adopted at the United Nations Conference on Housing and Sustainable Urban Development, Habitat 3. The new urban agenda sets out a common vision for sustainable and healthy urban development for the next 2 decades. Now, this WHO Urban Health Initiative. This was launched to help implement the health aspects of new urban agenda, and it focuses on the determinants of health in urban settings and works on integrating health considerations into urban and territorial planning. Now, the Lancet series on urban design, transport and health in 2016. This series of articles provided an evidence-based global perspective on how urban design and transport contribute to the health of urban populations. Now, we have discussed in the video on climate change that United Nations Climate Change Conferences, COPs, the various COPs, particularly after the Paris Agreement in 2015. They have addressed the impact of climate change on urban health, focusing on issues like air quality, urban heat islands, and the health risks of extreme weather events. Then WHO guidelines for integrating health in urban and territorial planning in 2020. These guidelines provide a resource for improving public health and well-being through urban and territorial planning, offering practical solutions to countries and cities. WHO Global Health Observatory. This initiative gathers data on urban health indicators to monitor and compare health and environmental data across different cities globally. Now, finally, this Global Parliament of Mayors, GPM, it is an innovative governance body of, by, and for mayors from all continents. It was founded in 2016. The GPM offers a platform for mayors to work together on global challenges that are increasingly felt at the local level. So, all these initiatives reflect an integrated approach to tackling urban health. Now, coming to some key solutions that have been advocated during these global dialogues. The first is to provide safe water and sanitation to all, which is recognized as a human right. In this regard, solid waste management in urban areas is critical. Blocked drains and stagnant water provide breeding grounds for mosquitoes and vectors. The sanitation service chain must be developed, financed, managed, and maintained continuously. Community level coordination is important for these services to be effective. Next solution is integrating health in urban planning and city design. It is true that urban infrastructure is difficult to change once it is in place. However, this can be done in multiple steps. For example, Copenhagen, Denmark embarked on a multi-decade project to remake the city completely. Next important aspect is to make cities age-friendly. The world is becoming older and more urbanized. Still, most of the cities in the world are designed for young and working population. This requires action in specific areas. Now, which are these areas? Like outdoor spaces and buildings, transportation, social participation, civic participation and employment, respect and social inclusion, communication and information, and community health services. Next important point is to plan cities for resilient urban environments. With increasing climate change, natural phenomena like floods, earthquakes, and heat waves impact both built and social environment. Cities are generally 1 to 3 degrees Celsius warmer than rural areas due to urban heat island effect. Some cities like Toronto and Paris have adopted policies for green rooftops and solar panel roofs. The next issue is that increasingly motorized cities amplify the risk of road accidents along with air pollution. So, cities should work towards providing desirable alternatives. Investments should be made in bicycle pathways and roadways should be managed in a manner to assure safety of bicycle riders. Measures to reduce speed are critical, preferably to 30 km per hour in residential areas. Traffic calming devices such as roundabouts, intersections, traffic lights, crosswalks are of utmost importance. Most important are safe school zones, which are largely ignored in developing countries. So these were some of the solutions that were discussed during major global events. Now, several global case studies exemplify successful strategies and interventions that they have adopted in addressing urban health challenges. Here are few examples. The first example is Copenhagen, Denmark. So Copenhagen is often cited as one of the most bicycle friendly cities in the world. The city has extensive bicycle lanes, green spaces which encourage physical activity, reduce vehicular emission, fostering a healthier urban environment. Now, second example is Barcelona's bicycle scheme. Barcelona's bicycle scheme started in 2007 to promote bicycle as a common means of transport. As part of Barcelona's urban mobility plan, the city council is focused on enhancing cycle safety. New cycling routes are being constructed that are physically separated from traffic, and traffic lights and signs are being designed following safety regulations. Then next example is the Liverpool Healthy Homes Program. The HHP is a major initiative aimed at improving housing conditions, particularly in the private rented sector. Deprived areas of the city are proactively targeted where visits are made to every house. And these visits are made to assess the risk to health of housing conditions. And next is bus rapid transit BRT system in Curitiba, Brazil. Curitiba is renowned for its innovative public transportation system and urban planning. The city has a well integrated bus network and has dedicated lanes for rapid transit buses. This system has reduced traffic congestion, pollution, contributing to better urban health outcomes. Now, last case study to be discussed here is car-free days in Bogota, Colombia, the Ciclovia days. Bogota closes off large sections of city streets to cars every Sunday and on holidays to allow residents to cycle, run, skate, and participate in exercise classes. This initiative called Cyclovia has not only encouraged physical activity but also social inclusion and community well-being. The practice of cyclovia has now been adopted in many cities around the world. So these case studies show the variety of approaches cities can take to promote urban health. To summarize, the relationship between urban environments and public health is complex, with cities facing unique challenges that require thoughtful solutions. Initiatives such as Barcelona's Bicycling Scheme, Liverpool Healthy Homes Program, and other case studies discussed here, they illustrate the proactive steps cities can take to address public health concerns. Thus, cities can be transformed into engines of well-being and sustainability. This points towards a future where cities are synonymous with health and vitality. So, I end my presentation with this note. Thank you very much for listening. Please like and subscribe the channel. See you again with the next video. Thank you. Bye bye.